Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, the Chief Medical Officer of Health; the Honorable Blaine Higgs, Premier of New Brunswick. Les personnes suivantes prendront la parole de la séance d'information cet après-midi: le Dr. Jennifer Russell, médecin hygiéniste en chef, et le Premier ministre du Nouveau-Brunswick, l'Honorable Blaine Higgs. Dr. Russell.
Merci, Bruce. Good afternoon, everyone. Bonjour à tous et à toutes. Before I begin, I would like to talk a bit about the masks. So you'll see that I'm wearing a mask today, as is the Premier. And this is a precaution due to my recent visit up to Zone 5, which was a very productive visit. And I'm so glad that I was able to get up there with members of our team at the Department of Health. And so because I've been in the orange phase of recovery, where COVID-19 is active, I'm taking every precaution to avoid making myself an agent of its spread, and following the same guidance that I have provided to anybody else who's traveling back and forth for essential reasons to Zone 5. So for the next 14 days after my return from Zone 5, I'll be wearing a mask and asking others who are not distancing and in the same room as I am to do the same. And I will definitely not be attending any large gatherings, and I will definitely be protecting vulnerable people, vulnerable populations, and maintaining physical distance and washing my hands frequently. And I ask this of everyone who travels to and from orange zones. That is what the public health guidance is. So I'm following my own rules. My mom had joked with me a long time ago, very early on in the pandemic, that she was following my rules. So now I'm following my rules. Depuis notre dernière séance d'information, 2 autres personnes sont décédées de la COVID-19 au Nouveau-Brunswick. Nous discutons souvent des statistiques liées à la pandémie, mais il ne faut pas oublier que ces personnes avaient une famille et des gens qui les aimaient. Les familles de ces 2 victimes de la COVID-19 et celles de toutes les autres victimes de la COVID-19 sont en endeuil aujourd'hui. Et je tiens à ce qu'elles sachent que tous les citoyens du Nouveau-Brunswick partagent leur deuil. Votre perte est aussi la nôtre. The outbreak in Zone 5 is still underway, and while we have made progress, we must remain vigilant and take extra precautions to protect our most vulnerable citizens. I stopped in to see the public health staff in Camelton as well as Bathurst. I stopped in to see the staff who were on site at the arenas in Camelton and Dalhousie on Saturday and Sunday. I met with mayors, I met with MLAs from all around that area, including Baldoon. So there was quite a lot of information that was shared to help everyone understand what it is they can do to protect themselves based on the information of how things have been transmitted in Zone 5, but also the same things that we were seeing in terms of how things were transmitted in Zone 1. In both of those outbreaks, we would like to see people always wearing their mask indoors, especially anytime you're in the workplace with your fellow employees, whether you're on a break, whether you're working or not. That is one of the settings where we were seeing transmission. We were also, and so I was communicating that message, we were seeing people who had mild symptoms and weren't getting tested, so we were giving that message as well. And the message around close contacts. We were seeing some of the spread happening in situations where people in close-knit communities with good networks and healthy networks, that is wonderful for support in mental health. But in a pandemic and an outbreak situation, those numbers of close contacts are not conducive to trying to limit the spread as quickly as possible. So we're asking that people limit their close contacts to their one household bubble in the orange. So the other thing that has just happened is we have a positive case at the Résidence Saisons. And this is an adult residential facility in Balmoral. And so there is one confirmed case in the facility. And so therefore we're declaring an outbreak. and we are taking very aggressive steps at this moment to limit the impact of this outbreak. So the entire facility is being tested with respect to residents and staff, and I think most of them were being tested today with a rapid test. And so we should get those results back very shortly, and then take next steps in terms of what has to be done to prevent the spread and contain it quickly. C'est pourquoi j'annonce aujourd'hui une éclosion de COVID-19 à la résidence 4 Saisons, un établissement résidentiel pour adultes situé à Balmoral. Un cas de COVID-19 a été confirmé à cet établissement et nous prenons des mesures rigoureuses pour limiter les répercussions de cette éclosion. Une importante équipe de dépistage de masse est présentement sur place à l'établissement résidentiel et tous les résidents et membres du personnel subiront un test de dépistage aujourd'hui. So we know that local outbreaks will continue to occur in the months ahead all around the province, and we won't be surprised when that happens, but we won't be unprepared. I did ask one of the epidemiologists that works with us to frame the risks when I say, oh, the risks are going up all around us outside the Atlantic bubble. What does that really mean? Well, in July, 300 cases were diagnosed of COVID-19 on a daily basis in July in Canada. Today, in Canada, we diagnose 2,700 people with COVID-19 a day. That is a very huge increase, which means the risks outside of New Brunswick and outside the Atlantic bubble are huge and continuing to increase. So when we try to do the things that we're doing right now to limit the spread in terms of travel-related cases coming into the province, we also have to be extremely vigilant about what happens when COVID does get into the province and what steps and measures we need to do to be prepared to keep these outbreaks small and help get them under control very, very, very quickly. And that takes everybody working together to make that happen. Obviously, the best strategy is to prevent them from happening in the first place, but again, we can't control the number of people coming into the province for essential work, but we can do things that make it safer. So the vast majority of our COVID-19 cases come from people who have traveled outside the Atlantic bubble. And we know there are about 12,000 people who cross our borders every day for essential reasons, and any one of them can carry the virus. And again, with the numbers going up outside the Atlantic bubble, it's a numbers game. It's almost impossible statistically to avoid this. So many of these people travel to other provinces for work in jurisdictions where infections are on the rise. So as these risks are increasing, we really don't have a choice to do anything but act now to make changes to make things safer right now. So doubling down on decreasing those risks is very, very important for New Brunswick so that we can get through the winter and be able to celebrate the holiday season in yellow everywhere in New Brunswick. And Cabinet has just approved new measures to reduce this risk. New Brunswickers who travel out of the province for work will be directed to enter a modified form of self-isolation upon return for up to 14 days, depending on their length of stay back in New Brunswick. There will be the option of reducing this time by being voluntarily tested for COVID-19. There is a similar pilot being trialed in Alberta right now. Ours is slightly different, but these new measures that we're doing, implementing right now will not stop people from traveling for work, which is important for our economy and everybody's well-being, but it will reduce the risks. Again, we cannot reduce the risk to zero. We know that. So what can we do to manage the risks as effectively and as efficiently as we possibly can? So reducing the chance that COVID-19 can spread in our province is a priority, and we're seeing our neighboring provinces and states having difficulty doing this. So today there are 4 new cases of COVID-19 in New Brunswick, and those new cases include in Zone 1, an individual aged 60 to 69, in Zone 5, 1 individual aged 50 to 59, and 2 individuals aged 60 to 69. And I know I have heard people say that they feel more reassured when I announce the new cases as self-isolating at the moment. And I can tell you that they are self-isolating right now. I don't have the information of whether they were already on our list of contacts and were already self-isolating, but when I have that information, I will provide it. And the number of active COVID-19 cases continues to fall, and it is now at 51, and there are 4 individuals that are hospitalized at this time. Aujourd'hui, il y a 4 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Les nouveaux cas sont les suivants. Une personne âgée de 60 à 69 ans dans la zone 1, une personne âgée de 50 à 59 ans et 2 personnes âgées de 60 à 69 ans dans la zone 5. Le nombre de cas actifs de COVID-19 continue à diminuer, se chiffrant présentement à 51 cas. À l'heure actuelle, 4 personnes sont hospitalisées en raison de la COVID-19 et j'aimerais que vous les gardiez dans vos pensées. I was in Hamilton and Dalhousie and Beldoon and Balmoral over the weekend up in Zone 5. And that area I was really, really impressed by the spirit of the people that I met there. I know how determined they are to bring the area back to the yellow phase of recovery along with the rest of the province. I also want to give a shout out to Public Safety and WorkSafe, who had done some inspections over the weekend and did some education, et cetera, to really help increase compliance up there, and I know that they were very successful. So there was a lot of work that has been done in Zone 5, and we're definitely moving in the right direction, but we will keep an eye on the situation and keep an eye on the new cases as they arise. So we are happy that the things that we have implemented in the last week or so have been successful in terms of seeing we're not seeing a continued increase in the number of cases in a dramatic way. So we are very happy in terms of the compliance and how things have improved. But again, we're not out of the woods yet. We do still have a lot of work to do. And I do want the rest of the province to be staying on their toes as well, because again, we know that this can happen at any time in the rest of the province. And I know I did get some information about the outbreak in Calais right now. And so, you know, that's very, very close to St. Stephen. And so I think everybody in that area really needs to be vigilant at this point in time. I also had a message from the Regional Medical Officer of Health down in the South Region, Dr. Barker, and apparently there's an issue in Quispamsis with people flushing non-flushable items down the toilet. I think they're wipes. So I think that's causing a lot of problems with the sewage system in Quispamsis. So that's a note, a request from the Regional Medical Officer of Health in that area. Je tiens à remercier sincèrement toutes les personnes de la zone 5 qui continuent de suivre les conseils de la santé publique. Votre vigilance et votre travail acharné portent fruit. Notre équipe continue de surveiller de près l'éclosion dans la zone 5 et nous réévaluons la situation chaque semaine. Si la situation continue de s'améliorer, j'ai bon espoir que nous aurons bientôt des bonnes nouvelles pour les gens de la zone 5. On travaille tous ensemble comme une très belle équipe à ce moment-ci. On va continuer ce travail pour voir des résultats positifs, j'espère, dans les prochaines semaines. So testing remains a cornerstone in our strategy to limit the spread of COVID-19 in New Brunswick. And this week, our laboratory at Georges Dumont Hospital in Moncton has processed more than 100,000 tests since the pandemic began. We are continuing to test strategically, testing the right people in the right places at the right time. And over the weekend, we were happy to see a great turnout in Zone 5 for the mass testing to test for the virus in that area. And we conducted 2,400 tests, of which 2 were found to be positive. So we're looking at that in terms of the indicators for the outbreak, and I'm concerned that the outcome is not going to completely show a complete picture in the sense that you know, we analyzed the data in terms of the age groups that were being tested, and it would be good if younger adults between the ages of 20 and 40 were tested as well in terms of having symptoms. So because we know the virus can affect people of all ages, and certainly in the younger population, they are at risk of transmitting to parents and grandparents. Alors, j'ai des inquiétudes à l'égard du nombre de personnes de ce groupe d'âge qui pourraient avoir contracté le virus, particulièrement celles qui voyagent fréquemment dans des endroits où la COVID-19 est maintenant répandue. Depuis plusieurs mois, les citoyens du Nouveau-Brunswick qui voyagent à l'extérieur de la province pour le travail n'ont pas à s'isoler à leur retour. Cette stratégie était efficace quand le nombre de cas était faible, comme dans le mois de juillet. Mais tant ici qu'ailleurs au Canada, les circonstances ont cependant changé et nous devons maintenant adapter nos protocoles en fonction de l'évolution de la pandémie. Et c'est comme ça que ça va dérouler durant la pandémie. Fur et à mesure qu'on a des nouvelles recherches, fur et à mesure qu'on a des nouvelles informations au niveau de la surveillance, on va continuellement reviser nos protocoles pour démontrer que les risques vont changer et l'information va changer au niveau des directives qu'on recommanderait. Those who travel outside New Brunswick for work must now undergo modified self-isolation for 14 days upon return. They will, however, be allowed to leave isolation to obtain necessities, so long as they wear a mask and practice physical distancing. These workers will be able to access essential goods and services, including necessities of life and supporting services, healthcare, goods and services required for work, banking and financial services, transportation, animal care and funeral or visitation services for members of their immediate family. In addition, a person can be voluntarily tested for COVID-19 up to 3 times depending on their length of stay in New Brunswick. Testing must be scheduled using the online self-referral tool and will be completed at an assessment center nearest the individual. For example, a New Brunswicker who has traveled back and plans to remain in New Brunswick for 3 weeks before traveling out again will be required to undergo modified self-isolation unless they are voluntarily tested 3 times around days 0 to 2, 5 to 7, and 10 to 12. If the first test comes back negative, they are relieved from modified self-isolation until their next test. And if after the 3rd test they are symptom-free and continue to test negative, they are no longer subject to the modified self-isolation after day 10. And again, we are going to take into account all of the data that we receive from this approach, again, as Alberta is doing with their pilot study, and using that information to inform next steps. Individuals will continue to wear a mask while in public and follow public health guidance. Individuals intending to be back in New Brunswick for shorter periods can be tested the number of times required based on their length of stay. If planning on being here 1 to 4 days, they would need 1 test to exit modified self-isolation, and if they were here from 5 to 9 days, they would need 2 tests. A 14-day self-isolation upon or returning to the province is still required for non-essential travel following vacation, family visitation, or a move to New Brunswick. And that is what we know works the best. Again, what we're doing with the essential travelers is trying to manage the risk because we know it will never be 0. But we know that the best case scenario is 14-day self-isolation, as we saw with international students. That was very successful, as well as the temporary foreign workers. And any other travel-related cases that you saw pop up on the radar over the course of the last several months, those people who were self-isolating for 14 days and tested positive during those 14 days could not infect anybody else. So as of right now, these new protocols will increase our chances of catching infections before they spread. Les travailleurs qui arrivent de l'extérieur de la province ne sont pas les seules personnes à risque de contracter la COVID-19. Il est important pour les personnes qui travaillent dans un milieu à risque élevé, particulièrement le secteur des soins de longue durée, de surveiller les symptômes et de subir un test de dépistage régulièrement. I encourage everyone working in adult residential facilities, long-term care homes, and nursing homes to be tested every 2nd week. This is vital whether or not you are displaying symptoms of COVID-19. Protecting our most vulnerable citizens requires that those working with them take extra care of themselves. And if you are interacting with any of these people who work in those settings, please be very careful and cautious with your interactions with them. There are many things about COVID-19 we cannot control, but we can take control by watching our symptoms, getting tested when required, even if we think that it's too mild to be tested. Nope, don't second guess it, get the test. And we follow public health measures. There is a rising tide of COVID-19 all around us. If we fail to act, the tide can eventually overwhelm us, and that is definitely what we want to not happen. So if we stay together and look out for one another, I am confident that we can all keep above the waterline but it will take a collaborative and concerted effort from every citizen of New Brunswick. Un gros merci. Thank you.
Can everybody please mute your mic? Please mute.
Good afternoon. Bonjour. First of all, I'd like to thank Dr. Russell and her team for spending time in the Campbellton region this past week. I've heard many positive comments. It certainly is reassuring to see her and her team members address directly the concerns. We're on a weekly call with the local MLAs for the region so that they can be kept up to date on any of the evolving issues and the concerns they have currently now of the region being in orange. But we're all optimistic that, that'll improve over the coming days and weeks, and currently a lot of testing is being done to provide the necessary assurance to do so at the right time. To further protect the health and safety of New Brunswickers, we are accepting the recommendation of Public Health, and we are implementing the new COVID-19 border measures for workers entering or returning to New Brunswick from outside the Atlantic bubble. These measures are necessary because close to 95% of the COVID-19 cases in New Brunswick are the result of travel or someone who has been in close contact with another traveler who was positive. As Dr. Russell has explained, workers entering or returning, and particularly in this case workers returning to New Brunswick from outside the Atlantic bubble, are now subject to modified self-isolation directives for 14 days, with the option of returning to regular public health measures in the province by being voluntarily tested for COVID-19 and having negative results and no symptoms. Cette mesure ne s'applique pas aux conducteurs de camions, ni aux gens qui effectuent la navette chaque jour pour le travail. Elle ne s'applique pas non plus au personnel qui se rend au Nouveau-Brunswick en vertu d'un plan opérationnel approuvé par Travail sécuritaire Nouveau-Brunswick, car ces plans comprennent déjà une période d'isolement. Public health and public safety will be monitoring the impacts of this change to inform future travel options. Under the emergency order, travel into the Restigouche County from the Restigouche First Nation and Pointe-à-la-Croix, Quebec, is now restricted to between the hours of 6 a.m. and 10 p.m. Residents of these areas can only enter twice during a 7-day period for essential goods and services, and they must remain in Restigouche County while in New Brunswick. This does not apply to those with exemptions for attending school or accessing healthcare childcare. For the moment, Zone 5 will remain at the orange level of recovery, with the addition of the one household bubble. We encourage residents of that zone to continue to follow the directives of public health and to keep contacts to an absolute minimum. Des agents d'application de la loi additionnelle travaillent dans la zone orange pour s'assurer que la population respecte les directives de la santé publique et la retraite d'urgence. Nos agents, ainsi que leurs collègues de la GRC et de travail sécuritaire NB, travaillent pour assurer la santé et la sécurité des gens du Nouveau-Brunswick. In the last week, enforcement officers have visited 636 businesses and public spaces in the areas around the orange alert level. They also interacted with more than 5,800 New Brunswickers. In total, 18 tickets were issued for violating the Emergency Measures Act, and 81 orders and warnings were issued. A big part of their job is working to educate people about the requirements of the mandatory order. The handing out of a fine or the laying of a charge is usually the last resort. I am pleased to report that their hard work is paying off. The enforcement officers found the compliance rate is now at 99%, and yesterday, no tickets were issued. Ils ont constaté que la population fournit sa part d'efforts. Ils ont également reçu des commentaires positifs des gens qui sont heureux du travail effectué par nos agents pour assurer la santé et la sécurité de la population de Nouveau-Brunswick. We feel confident that thanks to the dedicated efforts of everyone who lives in the areas currently at the orange level, we'll be able to return Zone 5 to the yellow alert level in the near future. I understand there have been a lot of questions about Halloween in the province and what COVID-19 will mean for other important dates, including Remembrance Day and Christmas. Guidelines are available now on the GNB website for both Halloween and Remembrance Day. It is too early to determine what will happen with Christmas, but there are steps we can take now that will result in a happy holiday season for our province. The goal is always to protect the health and safety of New Brunswickers, which is why we are asking everyone to follow public health guidelines for the alert level that your zone is currently in. Taking precautions today means that we will be better able to have a more normal version of celebrations in the coming days. But it is up to you. You must do what is needed to keep yourself healthy and to protect those around you. You must follow the directions of public health and the mandatory order to limit the spread of this virus. What we are asking you to do is not hard, but it is important. We all have a role to play in slowing the spread of COVID-19. En travaillant ensemble, nous pourrons nous protéger et aussi protéger notre famille, nos amis et nos communautés. En travaillant ensemble, nous pourrons relever tous les défis auxquels nous ferons face. I hope you all have a safe and healthy, happy holiday Halloween weekend. Thank you. Merci.
Merci à toutes et à tous. Thank you all. We'll now proceed with questions from the members of the media. You have the right to pose your question in the language of your choice. Each reporter will have one question and a quick follow-up question. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste peut poser une question et un suivi. Bobby Jean McKinnon.
Yes, hello. Dr. Russell, it sounds like there's a lot of exceptions to the self-isolation new requirements. How exactly is it going to work?
Jean, the issue around essential travelers not needing to self-isolate, other than with people who are working for larger companies and have work isolation plans in conjunction with WorkSafe New Brunswick, that's been in place for a while. Those individuals who have been traveling for essential work have not been required to self-isolate, and obviously that is the increasing risk that we're trying to manage at this point in time. So what we're proposing is a way to manage that risk. Again, we can't get that risk to be ever zero in a pandemic in terms of how people come and go with respect to the need for essential workers to come back and forth across the border. So I don't have exact numbers in terms of how many people travel every day for the different types of work and how many people come for a certain length of time. But Department of Public Safety is working on a registration system to be able to capture that information so that we can be much, much more certain of the people that are coming in and staying for a certain amount of time and then leaving. And then on that voluntary basis, again, we're trying to follow a similar approach that Alberta has in place right now with their pilot program to do voluntary testing. And so with that information, one, we will be reducing risks, and number two, we'll be able to capture that data to inform next steps. So this is an improvement over what has been in existence already. And so again, with the increased risks in our neighboring jurisdictions across Canada and also in the US, this is one of the approaches that we're using right now to manage those risks.
Thank you, Dr. Ms. McKinney. Do you have a follow-up today?
Yes, you talk about the voluntary testing being similar to Alberta. Can you tell us more about how the voluntary testing will work?
Well, it's actually going to be a bit more stringent than Alberta's program pilot study. Ours is going to be dependent on how long the person will be in the province. So if they're going to be in the province for 14 days or longer, then they will be tested 3 times in that period. And I believe by day 10, if they've tested negative throughout that time, then they will no longer have to self-isolate. And then, and again, the other protocols will be based on how many days that they're in the province. So if they're staying just for less than a week or 5 to 9 days, it's broken down that way. And I did touch on that during the during my remarks in my speech.
Thank you, Ms. McKinnon. Thank you, Doctor. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, you mentioned that Atlantic Bubble border guards have been relocated to monitor the Quebec borders and international borders. Are any of these guards stationed in Charlotte County? And I'm also wondering, are any of these modified self-isolation guidelines for essential workers, are they also followed by international border, people who cross the international border for work too?
The requirement for travelers coming in that we have the day-to-day essential workers that are coming across our borders, that continues and as it has for some time. The new requirement is based on travelers that would go out of the province and work for a period of time, maybe 2 or 3 weeks, and then come back. And so the focus is anyone leaving the province for that period of time and then coming back home will fit into this new category of, like we've had a modified self-isolation, like we reduced that back 4 months ago or so. This brings in a heightened consideration to someone who's been away, particularly in the hot zones in the rest of the country, and then doing the testing, as Dr. Russell has described, in a voluntary basis, but determining their condition. It will apply to anyone that was leaving our province for a period of time and then returning.
Thank you, Premier. Ms. Hogarth, do you have a follow-up?
It's a little bit about the border guards. Are there border guards stationed in Charlotte County? Also, Campobello Island residents are allowed to enter the U.S. to obtain essential goods and services. But there also seems to be some confusion about what qualifies as essential. For instance, does that include dining in restaurants? And is there any way to monitor the Campobello Island border to make sure that people are just using the border for essential?
We did discuss that this morning in our COVID cabinet committee, and to clarify concerns and the regulations around traveling to and from what we've set up now with the Listigouche Nation, First Nations community and Pointe-à-la-Croix is basically we're looking at doing that same thing for Hamilton area, or sorry, Campobello, and the idea is to ensure that Campobello residents can get through to New Brunswick, have a consistent rules and regulations to follow when they're entering into New Brunswick from Calais, or when they're going back into Campobello from Maine. Also looking at essential services there is being evaluated right now, so the ones who would be right there on the border to go into Lubec, how that might be managed. So those issues are all being looked at right today, with the intent of making some improvements here to make life easier for residents to come to and from Campobello Island.
Thank you, Ms. Hogarth. Alan Deering, The Bend.
Good afternoon. Thank you, Bruce. There has been a lot of talk, especially in Nova Scotia more recently, about the Atlantic bubble teaming up with Cuba to form a Cuba bubble. Dr. Strang yesterday said that this is probably not a good idea, and even if it does go ahead, there'll be a 14-day quarantine upon return. I just wanted to get perhaps Dr. Russell's thoughts on the possibility of bubbling with Cuba. How do you feel about that, Dr. Russell?
Well, somebody asked that question to me either yesterday or the day before, and I thought it was an interesting idea. But again, the risks as of right now, in terms of anything that we do with the bubble, would have to be decided upon as a collective. So the 4 provinces together would have to agree on that. And I haven't really had any conversations myself personally, but anyway, any changes to the bubble would have to be agreed upon by all 4 Atlantic provinces.
Mr. Deering, do you have a follow-up today?
Yes, I do. This is probably more of a federal question, but I'll throw it out there anyway. Large airports, Toronto, Calgary, they're setting up temperature scanners. Is there any possibility, have either Dr. Russell or Premier Higgs heard if these temperature scanners will come to smaller airports anytime soon, like Moncton, Fredericton, St. John, for example?
I haven't heard that myself, but in terms of the technology and what that information can tell us about travelers, we know that the symptom of fever in patients with COVID can be fleeting, so it can last for a short while and go away and then come back. From a scientific perspective, we do know that about the scanners in terms of what information you get from taking people's temperature who are traveling. But certainly with the changes that we're making with respect to essential travelers right now in terms of the voluntary testing, we're very confident that we're going to hopefully gain a lot of information moving forward on how safely we can accommodate people traveling in and out of the bubble and in and out of New Brunswick.
Thank you, Mr. Deering. Thank you, Dr. Savannah Odd, Telegraph Journal.
Hello. I believe this is a question for Dr. Russell, but it honestly could probably go to the Premier as well. As you guys know, the COVID Cabinet Committee, of course, is there to hold government accountable on COVID-19 policy as it would in the legislature. And of course, the Department of Health has said committee members won't be able to know when an outbreak starts from a person who's holding a work exemption. So I guess I'm just wondering, what is the point in having that COVID Cabinet Committee if the members aren't able to receive information such as that in order to assess the success or failure of public health policy, in this case, the work exemption?
So the question you're asking is around, again, travel and how imported cases are getting into New Brunswick, whether it's from essential travel or whether it's from a non-essential travel, and whether the person had an exemption to self-isolate or not. And again, all the things that we're doing right now with respect to making changes around that, because of the increased risks outside of our jurisdiction, take into account all the information and data that we have right now and research. With respect to balancing privacy in these situations, it is very delicate, and I do understand the public wanting to know all of the information, but from a public health perspective, it is our duty to provide information to protect the public. If there's no risk to the public, then I don't have an obligation to share that information in terms of compromising somebody's confidentiality, risking stigma, risking persecution on social media, risking having death threats, et cetera, as we've seen in other types of situations. So the risks and benefits and pros and cons of sharing information that's necessary is very much a consideration, and we do have close contacts with our discussions with our privacy representatives, and so we do take that into account when we're making these decisions. Secondly, everything that we bring to COVID Cabinet in terms of public health recommendations, we supply the data and research to back up all of our recommendations. So if there was information that was private that we were using to support a recommendation, then obviously it would be couched in a presentation in terms of, here's information that we know about patterns of transmission, about risks outside the Atlantic bubble and outside New Brunswick, et cetera. So we frame the risks when we give our recommendations so that we are giving very, very accurate information around how to manage those risks, and then government then makes the decisions around those recommendations. So I don't have any reservations or qualms about sharing information that's necessary to protect the public and necessary to support arguments and recommendations from an evidence-based and a research-based perspective while protecting people's privacy.
Ms. Odd, do you have a follow-up?
I do, thank you, Bruce. For just on today's outbreak, I'm wondering, did the residents at the facility who tested positive share a room with any residents? Are there shared rooms? And do we know if the staff at the home work exclusively at that residence?
So we're early on in our investigation, and I don't think there's any more information that I can give you other than there is an outbreak that has been declared because of a case, and rapid testing was done of all of the residents and staff today.
Thank you, Ms. Odd. Thank you, Dr. Jean-François Boisvert, l'Acadie Nouvelle.
Oui, je commencerai avec une question, peut-être une précision pour Mme Russell. Je voulais savoir, concernant les travailleurs, les nouvelles mesures que vous mettez en place aujourd'hui, il y a beaucoup de travailleurs de la santé de la zone 5 qui proviennent de la Gaspésie. Est-ce que les nouvelles mesures que vous annoncez aujourd'hui les touchent ces gens-là qui viennent à tous les jours ou c'est seulement les gens qui viennent pour qui quittent la province pour de longues périodes?
Non, ça serait pour tous les gens, absolument, parce que même on recommande que les gens qui travaillent dans des endroits comme des foyers de soins, etc., pourraient se faire tester 2 fois par semaine. Alors, c'est vraiment ouvert à tous les travailleurs essentiels.
Merci, docteur. Monsieur Boisvert, as-tu un suivi?
Oui, suivi peut-être pour M. Higgs cette fois-ci. Demain, vendredi, il s'agira de la dernière journée de travail en poste pour le PDG du réseau de santé Vitalité, Gilles Lantaigne. Avez-vous peut-être un mot pour ce dernier et peut-être aussi préciser qui pourrait occuper son siège lundi, parce que son siège va être vacant?
Yes, that is true. Gilles Lantaigne retires tomorrow. The decision hasn't been finalized yet on who will be taking his place. Certainly, I wish Gilles the very best in his retirement. I think he served our province well and the Vitality Network very well, and we will be making the decision in the coming days or weeks.
Merci beaucoup. Thank you, Premier. Merci, Monsieur Boisvert. Marie Sutherland, CBC.
Hello, yes, question for Premier Higgs. Vitality has announced mass testing tomorrow for Beldoon, and Mayor Noel had told CBC News last week there was a confirmed case at the NV Power generating station and that other employees were being tested. Just wondering what's the current situation at that plant and in the community?
Well, again, confidentiality reasons, when we're doing our investigations, we communicate directly with the cases involved, and we communicate directly with any risk settings, whether it's a business, whether it's a school, etc. So I don't really have any other information other than for all the cases in the outbreaks in Zone 5 with respect to anybody who is a diagnosed case, they are self-isolating at the moment for 14 days, and any of their close contacts are obviously self-monitoring, and we're watching and waiting what unfolds there. But again, I can't comment on individual cases specifically.
Thank you, Doctor. Ms. Sutherland, do you have a follow-up?
Yes, I do. Dr. Russell, there's a hockey tournament coming up in St. Andrews, and I'm understanding that the local medical officers heard from some citizens that are worried about a large gathering of people from across the province being in the town. Just wondering what's your position on that event and what precautions are being taken by the organizers?
My understanding, and I can confirm this, that the Regional Medical Officer of Health has seen the plan, the operational plan, and who will be involved and who won't be involved and what types of precautions are in place with respect to that plan. My understanding is it meets the public health standards in terms of what's allowed and what can be done safely, and that is the understanding information that I have on that situation right now.
Thank you, Ms. Sutherland. Jonathan McInnes, CTV.
Hi, Dr. Russell. What prompted the mass testing clinic in Beldoon for tomorrow?
Well, we met with the mayor of Beldoon last Friday, and there was an intention to do that testing along with the Campbellton and Dalhousie sites at some point. So it was in the works in terms of trying to arrange that sooner rather than later to make sure that any residents there who wanted to be tested who were asymptomatic, similar to Campbellton and Dalhousie, these testing sites were set up for people who were asymptomatic, who may felt that they may be at risk, perhaps having been in contact with someone involved in some of the outbreaks right now.
Thank you. Mr. McInnes, do you have a follow-up?
I do, yes. Regarding the essential workers at now have to follow this modified self-isolation. Will there be any kind of a follow-up to ensure compliance from the province? Will that person need to report the results of their voluntary tests?
So we are working out some of those details with Department of Public Safety because, as I said, they are setting up a registration system to be able to collect the information. And then with respect to the testing results, they will need to be reporting them at some point with respect to then not having, then to be able to be released from their modified self-isolation. So the details on that right now are being worked on, but certainly the volunteer testing, they'll be identified when they do their self-referral on the online assessment form. They will be identified as such.
Thank you, Doctor. Thank you, Mr. McInnes. Callum Smith, Global News. Callum. Eloise Rodriguez, Radio-Canada.
Oui, Dr. Russell, je comprends que cette nouvelle directive pour les voyages, ça s'applique seulement aux travailleurs essentiels, mais est-ce que vous avez des plans pour élargir ça à tous ceux qui entrent dans la province, éventuellement?
À ce moment-ci, c'est difficile à dire parce que on sait que avant qu'on aura de l'information produite de ces recherches, parce qu'on va garder toute l'information et l'analyser, qui est vraiment comme la situation en Alberta. Ils vont faire quelque chose proche de ce que nous en faisons. Mais après qu'on aura plus d'informations, les résultats de ce protocole, on ne pourrait pas vraiment commenter sur ce que ça peut donner au futur. Qu'est-ce qu'on sait vraiment maintenant, d'après notre expérience cet été avec les travailleurs étrangers et aussi les étudiantes, des étudiantes internationales, ils ont fait le 14 jours d'auto-isolement. Ils ont été testés sur la 10e journée et je crois qu'il y avait presque 1000 personnes en cette situation et je crois qu'on avait 12 qui ont testé positif. Mais ça nous démontre que la meilleure chose, le meilleur protocole, c'est le 14 jours. Mais parce qu'on n'avait pas de protocole qui disait qu'il fallait faire de auto-isolement pour les travailleurs essentiels, on voulait vraiment faire des changements pour diminuer les risques qui existent parce que le nombre de cas de COVID-19 augmente tellement haut dans les autres parties du Canada et aussi aux États-Unis.
Merci, Dr. Louise. As-tu un suivi?
Oui, on a entendu au Nouveau-Brunswick quelques inquiétudes parce que quand les gens font du dépistage, le résultat est donné par l'endroit où le cas de COVID a été dépisté et non pas par l'endroit où la personne vit. Alors, certains s'inquiètent que ça donne un faux sentiment de sécurité aux résidents qui pensent qu'il n'y a pas de COVID dans leur région. Pouvez-vous expliquer pourquoi vous comptabilisez les cas par endroit où c'est dépisté et non pas par résidence de la personne?
J'ai entendu cette question plusieurs fois. Je vais essayer de la répondre dans une manière que vous comprenez. C'est vraiment pour analyser les cas qui sont liés à une éclosion. Et la manière qu'on fait le traçage et la manière qu'on analyse la situation, c'est vraiment important pour les épidémiologues et notre équipe de santé publique avoir l'information comme telle. Je sais que les inquiétudes que les gens ont au niveau de comment on donne le rapportage pour donner l'information sur les cas, c'est parce qu'ils veulent savoir, si c'est dans ma zone, j'ai peur qu'il y a des risques ici. Quand on a le rapportage des cas, ils sont en auto-isolement pendant 14 jours, alors il ne devrait pas avoir un risque comme tel. Je sais ça cause des inquiétudes parce qu'ils veulent savoir, mais vraiment, le risque d'avoir des éclosions n'importe quel temps, n'importe où dans la province existe et les risques continuent à augmenter parce que les nombres de cas hors du Nouveau-Brunswick, comme je vous ai dit tout à l'heure, dans le mois de juillet, tout autour du Canada, le nombre de positifs de COVID-19, de cas, c'était 300 par jour. Aujourd'hui, on est rendu à 2700 cas de COVID-19 annoncés chaque jour au Canada. Ça, c'est un risque très, très, très élevé. Alors, je veux que tous les citoyens du Nouveau-Brunswick soient vigilants et non pas seulement s'il y a une éclosion ou s'il y a un cas dans leur zone. Il va toujours avoir des cas, il va toujours avoir des éclosions. Il faut suivre les directives de santé publique tout le temps. Et vraiment pour éviter de propager l'éclosion, parce qu'on ne sait jamais quand que ça va commencer. Et pour minimiser les risques, il faut vraiment faire certain que vous avez le nombre minimum de contacts étroits. Et dans les endroits comme la Colombie-Britannique, ils ont suggéré de limiter les contacts étroits de les gens qui demeurent dans votre maison et peut-être 6 autres personnes. Mais ça, c'est des avis qui ont été suggérés à la Colombie-Britannique. Mais c'est vraiment quelque chose de concret qu'on peut dire, OK, ben, pour diminuer les risques d'une éclosion et diminuer les nombres de contacts étroits, ça, c'est quelque chose qu'on peut faire. On peut continuer à mettre notre masque et on peut se faire tester même si on a des symptômes très faibles.
Merci, docteur. Merci, Héloïse. Mathieu Wacomo, l'Acadie Nouvelle.
Bonjour, j'aimerais parler de tests rapides. Le Nouveau-Brunswick a reçu du fédéral très récemment des tests ID Now et puis va recevoir bientôt d'autres tests d'Ottawa, des tests rapides PAM Bio, et on a aussi déjà les tests Gene Expert. Dr. Russell, pouvez-vous m'expliquer la différence entre les 3 sortes de tests, ou en tout cas là, pourquoi on voudrait 3 sortes de tests rapides différents?
Alors, une raison, c'est parce que ça, c'est des nouvelles sortes de tests qui sont disponibles maintenant. Au commencement de la pandémie, c'était seulement le PCR qu'on utilisait. Et après ça, on a le Gene Expert. Mais le problème avec les Gene Expert est qu'on a seulement tel nombre de machines, puis tel nombre des choses qu'on a besoin pour les faire tester dans les différents endroits. La chose avec avec le nouveau, ça c'est la distribution a été commencée le 21 octobre et ça c'était une approche qui était toute décidée avec toutes les provinces et territoires. Puis ça veut dire que la distribution a été décidée proportionnelle aux populations. Et je crois que Ontario avait soumis une demande de priorité pour leurs endroits où il y avait des éclosions de COVID-19 qui sont élevées. Alors, c'est le gouvernement du Canada qui ont l'acheté, puis je crois que c'était 7,9 millions tests et de ID Now et aussi 20,5 millions PAN Bio COVID-19 tests rapides. Alors, ça, c'était vraiment pour donner aux provinces sans frais pour augmenter leur capacité de tests rapides. Et c'est pour ça la question vraiment était pourquoi qu'on a 3 différentes sortes. Et je crois que c'est juste vraiment pour optimiser l'apprivoisement des tests de dépistage pour notre population. C'est juste un autre outil qu'on aura pour faire des tests qui seront vite faits. Comme vous savez, le test de PCR qu'on fait maintenant, ça prend 24 heures pour recevoir les tests. Les tests Gene Expert qu'on a maintenant, ça prend, je crois, 1 heure après que c'est rendu à laboratoire, puis il peut faire le test. Alors, c'est juste quelque chose d'autre pour augmenter les outils qu'on peut pour combattre le COVID-19 avec les dépistages qu'on a.
Merci, Dr. M. Roy. Comment on suivi?
Oui, merci. Sur le même sujet, Dr. Russell, pouvez-vous me donner quelques exemples de dans quel contexte on utilise ces tests rapides et dans quel contexte on va utiliser les nouveaux tests rapides, où est-ce qu'on s'en sert et pour quelles raisons, à quel moment?
Alors, on a un groupe de travail sur tous les détails sur les laboratoires. Les informations que moi j'ai maintenant, c'est vraiment avec les distributions, puis quand on aura la possibilité de commencer à l'utiliser. Je sais aussi qu'il y a des compagnies privées qui vont les faire pour leurs propres employés, etc. Alors, c'est vraiment juste augmenter la capacité en anglais, c'est point of care testing. Parce que ça, c'est quelque chose qui peut être vite fait et sans nécessairement tout d'équipement de laboratoire qu'on a besoin avec le Gene Expert puis le PCR.
Merci, M. Wakomo. Wildernet Paul, Radio-Canada.
Merci, Bruce. Bonjour, Dr. Russell. Petite question au sujet de cette nouvelle mesure. Si c'est possible d'expliquer en français comment ça va fonctionner exactement, ce dépistage volontaire, et pouvez-vous nous dire à quel point ça sera efficace à votre avis?
Alors, j'ai entendu pas mal votre question au niveau de...
Oui. Je te sais mieux. Est-ce que vous m'entendez?
Oui, peux-tu répéter la question, s'il vous
Oui,
plaît?
bien sûr. Alors, Dr. Russell, j'aimerais juste savoir comment ça va fonctionner exactement, ce dépistage volontaire à propos de cette nouvelle mesure et à quel point, à votre avis, ça va être efficace.
Oh, j'ai mal entendu encore. Je crois que vous voulez savoir qu'est-ce que ça va donner au niveau des informations qu'on peut utiliser pour faire des changements au niveau de les risques qu'on voit maintenant et diminuer les risques?
Non, en fait, Dr. Russell, c'est sur la nouvelle mesure, à votre avis, à quel point ça va être efficace selon vous, cette nouvelle mesure que vous annoncez aujourd'hui.
Efficace au niveau des voyageurs et des travailleurs essentiels?
Exactement.
Qu'est-ce qu'on voit maintenant que depuis le mois de juillet, on n'a pas de restrictions sur les gens qui travaillent pour des raisons essentielles. Alors, ça veut dire que les gens pourraient rentrer au Nouveau-Brunswick après voyager pour du travail, peut-être en Alberta ou n'importe où. Et il n'y avait pas vraiment de quoi qu'il fallait faire, sauf qu'ils pouvaient revenir et il n'y avait pas d'auto-isolement, sauf que s'ils travaillent avec WorkSafe NB, avec un protocole pour isolement de travail, ça, c'était des situations spécifiques. Mais ces nouveaux protocoles vont inclure tous les travailleurs essentiels et ça veut dire que tous les travailleurs essentiels pourront se faire tester volontairement 3 fois dans 14 jours. Les premiers 14 jours qui vont être ici aux provinces, ils vont se faire tester volontairement 3 fois. Si les 2 tests au premier vont retourner négatifs, ça veut dire qu'ils n'auront plus besoin de faire l'auto-isolement. Alors, ça veut dire que c'est moins de risques qu'avant parce qu'il n'y avait pas de test et il n'y avait pas d'isolement, sauf que si ça faisait partie du protocole avec un plan qui avait été développé avec WorkSafe New Brunswick, avec des compagnies comme telles. Ça, c'est des gens qui sont, soit ils travaillent pour eux-mêmes, ou ils ne font pas partie d'un protocole qui a été approuvé par le WorkSafe NB. Alors, c'est vraiment quelque chose de volontaire et même les gens qui travaillent ici chaque jour, ils peuvent se faire tester 2 fois par semaine, même s'ils n'ont pas des symptômes.
Merci, docteur. Mademoiselle Paul, as-tu suivi?
Oui, merci beaucoup, Bruce. Dr. Russell, j'aimerais juste qu'on passe sur le point sur les foyers de soins de la province. Vous annoncez un nouveau cas aux 4 saisons. Quel est l'état de la situation dans les autres foyers de soins? Je pense entre autres au manoir La Sagesse, au manoir Notre-Dame.
L'éclosion à la manoir de la Sagesse a été déclarée terminée. Alors, il n'y a plus de risque à la manoir de la Sagesse. Le nouveau manoir qui a une éclosion, il y a 1 cas. Alors, la déclaration a été faite aujourd'hui et tous les résidents et tous les employés sont faits tester aujourd'hui. Et tous les protocoles qu'on fait dans chaque éclosion dans un foyer de soins, etc., c'est le même pour chaque. Alors, on attend les résultats. Puis, si nécessaire, notre équipe prompt va gérer la situation, comme les autres manoirs.
Merci, Dr. Russell.
Merci, Mademoiselle Paul. Jacques Poitras, CBC.
Hello, this is a non-COVID question for the Premier. What are your plans for a review, the mandatory 10-year review of the Official Languages Act?
Well, at this point, we're looking at the requirements under the Act and putting the plan together. We know that plan has to be finalized by the end of December of this year, and the review has to be completed through the 2021. So we will be announcing our plans certainly within that time frame.
Thank you, Premier. Mr. Poitras, do you have a follow-up today?
Yeah, what are your thoughts on a committee holding hearings, and if so, would those hearings happen in public?
Well, that's certainly what we're evaluating at this point in time. Firstly, I want to get clarity on the requirements under the Act, so I'm sure that I'm in compliance, and then we'll look at the pros and cons of the process based on past experiences.
Thank you, Premier. Thank you, Mr. Poitras. That concludes today's update. Thank you very much. Cela conclut les séances d'aujourd'hui. Merci beaucoup tout le monde.